At CMH, we provide services to approximately 130,000 people in a rural 8-county area north of Springfield, Missouri. 25% of Missouri's population lives in rural areas, yet 70% of health professional shortages are in rural communities. Rural health clinics fill a critical need in rural communities by increasing access to care. Nationwide, rural health clinics serve more than 37 million people. At CMH, 14 of our 34 physician clinics are certified rural health clinics. In addition to traditional medical care, our clinics include behavioral health services in our clinics and in our local schools, addiction recovery, chronic care management, care coordination services, and community resource specialists who connect patients with other organizations that can help with basic needs such as transportation, food, or housing.
I grew up in, small areas far away from everything, and I always noticed that everybody needed, care in those areas. A lot of times I had to drive an hour to get someplace when I was a child, and to me, all the people in the small areas need that as well. And so for me, I liked being one person who could be nearby, that everybody knows, and I know everybody there. So for me, it's more about a family, and so I get to know everybody's family, and I feel like I'm a piece of that.
I grew up in upstate New York in a rural community. I think when we moved there was only about 700 people, and it's a small dairy farming community. And so my experience in medicine from a young age was with a small rural hospital, and I actually had a chance to shadow a surgeon there when I was in my teens. My mom was a nurse, and so I always kind of felt an affinity for rural communities. It's important to understand the specific regional needs of a rural community, and to kind of understand what the types of employment might be in those communities, and the types of injuries people might sustain, and also the educational needs.
A lot of people wouldn't have care if it wasn't there, or they would have very limited care. I also have a lot of patients who aren't willing to go a long distance, so they just don't do things. But with our clinic right there and easy access, and feeling like a part of the community, they're more likely to come in and get the preventative things and get the tests that they need and come when they need help. I think anyone who's ever lived someplace away from town understands the need for essentials, which is what I consider medicine, to be close by, to be a part of the community. For me, I have patients who haven't seen somebody in 20 years because they don't trust somebody in another town. And so, once I'm there and I'm well established and everyone else knows me, then it's easy for them to come in and see me. Or, if something's going on, they normally would just put it off and put it off. It's easy for, I've had many spouses say, I said, just come see Dr. Dhondt. You don't have to see anybody else, just come see her. And they're willing to come in and see me because they trust me and I've been there and I'm a part of that.
It can be a very transformative process, and in the end, patients end up being very grateful as they start feeling better and they start seeing their laboratory numbers improve, and overall it's a pretty rewarding thing to experience.
As a member of the Board of Directors of the National Association of Rural Health Clinics, I see the great work that rural health providers are doing across the country. And I can truly say that CMH is a leader in rural health care. Our providers and our staff go above and beyond to fill the unique needs of each community.